What we've tried to do is put into this video, without giving the clinician a script, as much and as many of the sort of key skills that we think you need to have a good shared decision-making consultation as possible. And what I wanted to do was have a look with you at whether you'd like to reconsider the idea of taking something to reduce your risk of having a stroke.
Do you have any thoughts about what type of medication, if any, you would like to reduce your risk of stroke? Or would you like to think about it further?
And those are the things which are most important to you, aren't they?
Yes.
So I think it does leave us with warfarin as the option which is fitting.
Thinking about in the beginning.
Yeah, fitting best to the things that are important to you. Yeah. How do you feel about that?
One thing I'm not totally clear about is having a stroke important to you, or avoiding a stroke?
Of course, yes, absolutely.
I note from the records that Dr. Tomson said, in fact, your mother had a stroke, in fact, a hemorrhagic stroke. She bled into her brain because she was taking warfarin for atrial fibrillation. Yeah. How was that? Was that a devastating stroke?
Absolutely, yeah. Oh, yes, yeah. I mean, she was quite severely disabled, and it definitely shortened her life, there's no doubt about it. And that's one of my main reasons for not wanting to touch it.
Right. So I see. So that's slightly different. So it's not just the fact that the aspirin seems to be working at the moment.
Well, there is that as well.
But you're not happy with the warfarin because of the risk of bleeding.
Yeah, and it seems to be, you know, quite a high risk from what I hear. I mean, it causes bleeds.
It does. So I'll give you a sheet which is a decision aid that gives you the information about the drugs and about the risks versus the benefits. And I'll put all this in a letter which I'll send to you, and then you can think about it. If you want to come back to me and have a further discussion, or if you want to phone me up, the number will be on the letter, and we can have a further talk,
no,
and I can help you make a decision.
I would come back however I feel about it.
So before we talk about the different medications, can I just check your understanding of what we've talked about? So in terms of the risk of stroke and bleeding, can you just tell me what you've understood?
So there's 4 alternatives, and although they're broadly similar in the way they reduce your risk of stroke, they have got differences between them. And there's a lot of information in that brochure I sent you, so it doesn't surprise me it didn't all go in.
I find all that a bit
too much.
Yeah, just a bit
Fine.
too much.
So what I'd like to do is ask you about the things that are important to you, and then I can narrow down your options, and if there's more than one option left, then I can help you to make that choice, or you can tell me what you need to do to make that choice.
I've already prepared in advance a brief decision aid which has your individual risks identified on there.
Right.
You can take that away, have a look at it.
So at the moment you just take one tablet in the morning?
I take one tablet in the morning for my high blood pressure.
How would you feel about taking a medicine twice a day?
I think I would prefer it. If there is an alternative that's once a day, yes, I think I would prefer that, because I'm into the routine of taking my medication, and I think it would be safer, it'd be less likely to forget, you know, to take the second one if there was another one later in the day.
So that's quite important.
If we give you an anticoagulant, one of these drugs I'm talking about, that goes up to actually 24 people. So 15 extra people will have a bleed because we put them on this drug. So we've reduced your risk of stroke, but we've increased your risk of bleeding.
can I just check, what's your understanding of what I've explained to you? What do you think?
From what you've said is aspirin has no effect on that, but it has a large effect on a bleed on the brain.
But your risk of bleeding, if you don't change your alcohol intake, would be a bit more than it needs to be.
Right.
And if you're prepared to take that risk, you can still do that. It's just about choice and how bad it is for you to get a stroke versus how bad it would be to reduce your drinking a bit versus how bad it would be if you had a bleed.
I think that narrows your options down, Joan. So I think we've excluded all of the newer ones,
Right.
which are either more than once a day or have no antidote. Those are the things which are most important to you, aren't they?
Yes.
So I think it does leave us with warfarin,
With
as the option which is
Just one I was
fitting.
thinking about in the beginning.
Yeah, fitting best to the things that are important to you. Yeah. How do you feel about that?
I think I feel okay. I think I would like to go ahead.
Okay.
You know, I'd like to know a bit more about what it involves, but certainly,
Grand.
yeah.
So you don't have to make a decision today. So although we're talking about risk of stroke, you know, it's not urgent that we do something today, right now.
No.
You can have some more time to think if you want.
What's your preference, Jim? Would you prefer to take a once-a-day medication or twice a day? Because I see that you've got a combination. You are taking some of the medications twice a day, but the majority are once a day.
Well, I think once a day. But
You prefer once a
Margaret
day?
keeps me right with all the pills.
Okay. In terms of diet, do you have a liking for sort of very green leafy vegetables?
No,
Not
we
particularly.
eat
Not
pretty
particularly?
well, don't we?
No? Okay.
Looking at those diagrams here, have you got a feeling for whether or not you'd like to try an anticoagulant, Joan?
I'd already thought about it before I came, and you know, because of all the information you've given me, and the way I feel about it now, that it would just be common sense for me to go on it. Yes, yes, I would.